Did you know that over 50,000 people lose their lives to colon cancer every year? The startling part is that this number could be significantly reduced because colon cancer is one of the most preventable forms of cancer. What if I told you that a simple medical procedure could potentially save your life? That's right, a colonoscopy. A colonoscopy is not just a procedure, it's a powerful tool that can detect colon cancer and other colon-related issues, such as polyps, ulcers, and inflammation, in their early stages. Early detection is key, as studies show that survival rates for colon cancer increase by a remarkable 90% when caught in the initial stages. Yet, despite its life-saving potential, many people shy away from colonoscopies or delay them because of fear, misconceptions, or even embarrassment. The importance of colon health cannot be overstated. Our colon plays a crucial role in our digestive system and overall well-being. Ignoring symptoms like persistent changes in bowel habits, abdominal pain, or unexplained weight loss can lead to serious complications, including colon cancer. These symptoms are often dismissed or attributed to minor issues, but they could be your body's way of signaling something much more serious. If you've ever experienced changes in stool consistency, frequent constipation, or blood in your stool, it's important to pay attention. These are not symptoms to brush off, as they could be early warning signs of colon-related problems. For anyone over the age of 45 or those with a family history of colon cancer or polyps, regular screenings like colonoscopies are critical. Prevention and early detection can make all the difference. Before we dive deeper into the warning signs of colon cancer and the life-saving role of colonoscopies, I want to make a small request. If you're finding this information valuable, please take a moment to subscribe to our channel. Your support helps us create more informative content to guide you toward better health. Don't forget to like this video and share it with your friends and family who might benefit from this important information. Now let's move to the next part of this video, where we'll explore the colonoscopy procedure in detail and discuss how it works to detect and prevent colon-related issues. Stay tuned. Ever wondered what happens during a colonoscopy? It's simpler and less intimidating than you think. A colonoscopy is a straightforward and highly effective procedure designed to assess the health of your colon and detect potential issues early. It involves a carefully planned process, ensuring patient safety and comfort throughout. Let's break it down step by step to help you understand what happens during this critical screening. The procedure begins with the use of a colonoscope, a long, thin, flexible tube equipped with a small, high-definition camera at its tip. This remarkable tool allows doctors to view the inside of the colon and rectum in real time, providing a clear and detailed image on a monitor. The colonoscope also has an irrigation channel to flush out any debris that might obstruct the view, as well as channels for inserting specialized tools used to remove polyps or collect tissue samples for biopsy. As the colonoscope is gently guided through the colon, it provides a 360-degree view of the intestinal lining. Doctors are trained to spot even the smallest polyps or abnormal growths. If a polyp is detected, it can often be removed on the spot using tools like biopsy forceps or a snare polypectomy, a loop-like device that safely snips the polyp from the colon wall. These removed polyps are then sent to a lab for further examination to determine whether they are cancerous or precancerous. According to research, in over 95% of cases, removing these polyps during a colonoscopy successfully prevents colon cancer from developing, highlighting the life-saving potential of this procedure. One of the most common concerns people have about colonoscopies is discomfort. However, advancements in medical technology and sedation methods have made the experience much more manageable. Most patients receive mild sedation to ensure they remain comfortable and relaxed throughout the procedure. You might feel slight cramping or pressure, but these sensations are usually brief and mild. After the procedure, patients typically recover quickly and can resume normal activities by the next day. Understanding the mechanics and purpose of a colonoscopy not only demystifies the process, but also underscores its value as a preventative measure. It's not just a diagnostic tool, it's an opportunity to intervene early, prevent serious diseases, and take control of your health. By embracing this proactive approach, you're investing in a healthier future and reducing the risks associated with neglecting your colon health. Warning signs of colon cancer. You must know. Your body might be giving you silent warnings of colon cancer. Are you paying attention? Colon cancer doesn't often announce itself in its early stages with dramatic symptoms. Instead, the body gives subtle signs that can be easy to overlook or attribute to less serious conditions. Knowing these warning signs and acting on them promptly can mean the difference between early detection and delayed treatment. Let's take a closer look at the red flags your body might be waving. One of the most common early warning signs of colon cancer is persistent changes in bowel habits. This might include chronic diarrhea, prolonged constipation, or stools that appear narrower than usual. These changes can indicate a blockage or irritation in the colon caused by abnormal growths. Another critical symptom is blood in the stool, which can present as bright red streaks or darker tarry stools. Blood in your stool isn't always due to colon cancer. It can also result from hemorrhoids or other conditions, but it's a symptom that should never be ignored. Other signs include abdominal pain or cramping that doesn't go away, often caused by a tumor obstructing the passage of waste. Similarly, sudden and unexplained weight loss can signal something serious, as cancer can interfere with your body's ability to absorb nutrients and disrupt normal metabolism. Fatigue or weakness due to anemia, a condition where your body lacks enough healthy red blood cells, can also be an indicator. Colon cancer can cause slow, undetected internal bleeding over time, leading to anemia and its associated symptoms. Another commonly overlooked symptom is tenesmus, which is the sensation of incomplete bowel movements even when your bowel is empty. This can occur when a tumor blocks or irritates the rectum. Chronic bloating or trapped gas is another warning sign that may signal something more serious if it persists. Finally, rectal bleeding or discharge should never be brushed off. This could be caused by cancer or other conditions that require medical evaluation. Supporting data further emphasizes the importance of taking these symptoms seriously. Studies show that individuals who notice and address these early warning signs have significantly higher survival rates than those who delay seeking medical attention. It's also worth noting that these symptoms don't always mean cancer. There are benign conditions that can cause similar issues. However, ignoring them or delaying a medical evaluation can be a costly mistake. Risk factors and proactive prevention. Colon cancer is serious, but here's the good news. It's largely preventable. Colon cancer is not an inevitable fate. While it is one of the most common cancers, understanding the risk factors and adopting proactive measures can significantly lower your chances of developing it. Let's explore what makes some individuals more susceptible and what you can do to protect yourself. High-risk factors play a crucial role in determining who is more likely to develop colon cancer. Age is a primary factor, with the risk increasing sharply after 50. However, studies have shown that cases among younger individuals are also on the rise, which is why awareness and early screenings are critical. Family history is another significant factor. If a parent or sibling has had colon cancer or precancerous polyps, your risk is higher. This highlights the importance of discussing family medical history with your healthcare provider. Diet also has a profound impact on colon health. Consuming a diet high in red and processed meats while being low in fiber increases the risk of developing colon cancer. Fiber promotes healthy digestion and helps eliminate waste efficiently, which may lower the risk of cancerous changes in the colon. Other lifestyle factors, such as smoking, heavy alcohol use, obesity, and lack of exercise, further elevate the risk. Smoking introduces harmful toxins that can damage colon cells, while excess alcohol and a sedentary lifestyle create an environment conducive to inflammation and disease. Certain medical conditions like Crohn's disease and ulcerative colitis also increase the likelihood of colon cancer, as these conditions cause chronic inflammation in the colon. The good news is that proactive preventative measures can greatly reduce your risk. A diet rich in high-fiber foods, such as whole grains, fruits, and vegetables, supports gut health and may reduce the likelihood of cancer development. At the same time, cutting back on processed and red meats can lower your risk. Simple substitutions like choosing plant-based protein sources or lean meats can make a big difference over time. An active lifestyle is another powerful tool for prevention. Regular physical activity not only supports healthy weight management, but also improves bowel regularity and reduces inflammation throughout the body. Even 30 minutes of moderate exercise like walking or cycling can positively impact your colon health. Perhaps the most effective step is committing to routine screenings, which are vital for detecting colon cancer early, or better yet, preventing it altogether. Colonoscopy screenings, starting at age 45, are now recommended for average-risk individuals. For those with higher risk factors, such as a family history of colon cancer, screenings may need to begin even earlier. These procedures help identify and remove precancerous polyps before they have a chance to develop into cancer. In fact, research shows that removing these growths can prevent cancer in over 95% of cases. Don't wait for symptoms to take control of your colon health. Early detection can save your life. Colon cancer is one of the most preventable cancers, yet its impact remains profound. By now, you've learned how essential it is to recognize the early warning signs, understand the risk factors, and take proactive steps to protect yourself. Whether it's making better dietary choices, staying active, or scheduling routine colonoscopies, these actions can significantly reduce your risk and even save your life. The statistics don't lie. When colon cancer is detected early, the survival rate skyrockets to over 90%. This is why routine colonoscopies are so crucial. They are not just a diagnostic tool, but a preventive measure. Removing precancerous polyps during these screenings can stop cancer before it even starts. Early detection is not just a recommendation, it's your best defense. If you've been experiencing any of the symptoms we discussed, such as persistent changes in bowel habits, blood in your stool, or unexplained weight loss, don't delay. Consult your doctor immediately. Symptoms don't always mean cancer, but ignoring them could lead to late-stage diagnosis when treatment becomes more challenging. For those of you over 45, or younger if you're in a high-risk group, make scheduling a colonoscopy a top priority. If it's your first time, remember, it's a safe, simple procedure that could save your life. And if you've been putting off follow-up screenings, now is the time to take action. Regular checkups and early intervention can make all the difference. Let me share a quick story to leave you inspired. John, a 52-year-old father of two, avoided his first colonoscopy out of fear. By the time he finally went in for the procedure, doctors discovered precancerous polyps. They were removed, and today John is healthy and thriving. He often shares how that one decision not only saved his life, but ensured he could be there for his family. Stories like John's remind us how powerful early detection can be. So, here's your takeaway. Your health is your greatest wealth. Take control of it by staying informed, listening to your body, and making those critical appointments. Don't let fear or procrastination stand in the way of a healthier, longer life. Now it's your turn. Talk to your doctor. Schedule that colonoscopy. Share this information with your loved ones. Together, we can fight colon cancer, one early detection at a time. Stay proactive, stay informed, and take action today.